The Maryland board sends out an email saying you may not start practicing yet. We will tell you when you may start practicing.
Hey everybody, welcome back. I'm talking to Stephen Haywood again about a nasty email he got today. Do you want to tell us about that?
Oh, Maryland State Dental, the Maryland board sends out an email saying you may not start practicing yet. We will tell you when you may start practicing, and so on and so forth. If you had ever gotten an idea where you were going to start practicing and seeing regular patients again, we would have told you so. And pretty much that's the issue. It's the tone. It's, are we collaborating? Are we all in the same profession? Or are you going to tell us what we need to do, and should we maintain this fear? The fact is that the CDC requires us and put out some nice guidelines for how we're supposed to ramp up our practices. And first thing is everybody temperature. Everybody's got to have questions asked. Have you had a fever? Have you had a cough within the last couple weeks? Have you been in contact with somebody that's been proven to have COVID? You know, have you been in quarantine? So on and so forth. And document all these questions. And then the PPE that's required is readily available. And I think everyone's seen enough news to know that, you know, we need to be looking at the proper masks, face shields, protections within the office, and then professional distancing. How do we professionally distance from our patients now? It's not social. Now we have to maintain a professional distance, and eliminating things like the waiting area. There is no waiting. Come right on in. We got a chair set for you, and our office.
How do you manage that? Do you text them when they're here, or they text you and you say, "Come on in," and take
pretty much.
And then you take their temperature with a new thermometer?
The CDC guidelines say before they enter the healthcare environment, which we consider to be the back area, clinical area. So in the reception area, they'll be met with somebody with the gown, mask, face shield, and gloves. We get the temperature, we ask the questions, we move them back to their room if they're fine. And these are the guidelines currently for taking care of emergency patients. And moving forward, that's probably what we're going to have to do. So you asked me the question about, well, how do you space out the chairs in the waiting room? Easy, you take all the chairs out.
That's it.
Oh, you remember that magazine rack?
Oh, yeah. See, what a quaint notion. Chairs.
What a notion. Boy, how old-fashioned.
Right. We're going to be looking back. I hope there's not a million of those things that we'll look back on and say, whatever happened to...
I think that new world is going to look a whole lot different. We look around. We've been practicing for a while. We figure we got our place all set up. Well, good luck with that. Start rethinking everything. Brand new eyes.
Rethinking everything. That's what we're going to name this segment. Rethinking everything. Thanks, Dr. Stephen Haywood. Hey, can you give your phone number out one more time?
One more time, 410-258-7275. Anything with regards to infection control and CDC compliance, I'm your guy.
Thanks for everything. Thanks for what you're doing.
All right. Take care, Mike.